right, I am so excited to introduce to you our expert today. We have Dr. Jocelyn Gover with us. Hey, Dr. Gover.
Hi, thanks for having me.
We are so thrilled to have you and to pick your brain today. So, let me tell you a little bit about Dr. Gover. She's an assistant professor of clinical physical medicine and rehab. She completed her internship in internal medicine at Lenox Hill Hospital in New York. And then, followed by that, she did physical medicine and rehab residency at the U and Jackson Memorial Hospital, where she served as chief resident. So, she also pursued a subspecialty in pediatric rehabilitation medicine at Texas Children's Hospital, the Baylor College of Medicine. Is that in Waco?
In Houston.
In Houston. Okay, awesome. She has since returned to Miami and she's joined the Department of Physical Medicine and Rehabilitation as a faculty and medical director of pediatric rehabilitation medicine to develop the pediatric rehab division. So this is her space. This is her wheelhouse. She is a triple board certified. I've never even heard that. So bravo. I think that's probably a very big deal. In physical medicine and rehab, pediatric rehab medicine, and brain injury medicine by the American Board of Physical Medicine and Rehabilitation. And she currently provides inpatient and outpatient clinical care to individuals with various conditions resulting in disabilities or functional decline. So when I say expert, I mean it. Dr. Gover is here today, and this really is her area of expertise. So like I said, audience, if at any time you have a question, then I am going to have you just drop it right here in the Q&A, and then I'll do my best to get it in front of her. Okay. So I am so excited that you're here. Let's
Thank you so
dive
much for having
in.
me.
I am going to rapid fire you some questions. We've got lots of great questions to cover. And then
Okay,
as the audience has others, I'll put those in front of you. So,
that's good.
all right, let's just start with, I feel like everyone's heard of the term cerebral palsy, but I think there can be a lot of misunderstanding. Like, what does it mean? Like, what
Mhm.
causes it? Is there any way to prevent it? So tell us just kind of generally to start with.
Okay, that's a great question. Starting with what exactly is cerebral palsy. You hear the term a lot, you see it on TV, right? And people just have this picture of what it kind of could look like. But really, cerebral palsy is kind of an umbrella term that we use. If you kind of break down the two words, cerebral means having to do with the head, the brain, and then palsy meaning more like weakness and difficulties with movements, right? So you put it together and you have some weakness because of a brain injury. So when we think of cerebral palsy, we really think of kind of maybe three main criteria that make it fall under this umbrella term.
Okay.
The first is that a child had brain insult to the brain, right? Typically, this is a non-progressive, so a one-time injury to the brain.
Oh,
It
wow.
could have happened during pregnancy, during delivery, or within really the first 2 years of life or so.
Oh, wow.
But the injury itself was just this one-time occurrence, and the injury itself is not supposed to get any worse, right?
Okay.
That is different than some other conditions that we know that might be progressive or that injury to the brain might change.
Okay.
The second thing is more of timing. So again, it could be really within the first 2 or maybe 3, but 2 years of life, or again, during delivery or during pregnancy, if they've had some sort of malformation of brain structures or a little brain bleed, or they were exposed to some teratogenic or toxins, stuff like that.
Okay.
And the last thing, it's got to have some permanent motor involvement. So if they present and they just have behavioral issues or they just have vision issues, but they don't have motor involvement, it doesn't necessarily fall under that kind of spectrum.
Okay, interesting.
So really, it could be a lot of different things that
I had
could
no
kind of cause.
idea.
Yeah.
Like, this is question one, and I'm already like, in my mind, I thought it was something that you're born with it, like it's genetic or it's in utero, but I
Yeah.
had no idea that it can be like an onset because of like a brain
Yeah,
injury. Wow.
exactly.
Okay, you're already blowing my mind.
Good
Okay,
start.
it is a good start. So how then, I know you're saying this umbrella term, which also I didn't realize that either. So there is like the spectrum.
Mhm.
So how is CP diagnosed and how early can it be diagnosed? Like,
That's
is it something that can be diagnosed in utero or before birth?
that's also a great question. No, we can't typically diagnose it in Euro. And unfortunately, there's no one way to diagnose it. There's no one straightforward path, one test, one anything. We use it a lot we diagnose it mostly by history and physical exam.
Yeah.
So your provider will come and ask you questions. They'll ask about the pregnancy. They'll ask about the delivery. They'll ask about any other medical conditions that might the patient might have. And then we'll do a lot of observational studies on a physical examination. We'll look for how they're moving, if they're very tight in their muscles, if they have reflexes and the appropriate reflexes at the appropriate times. Are they making their their developmental milestones, or do they have a lot of delays? Typically, when we're finding a lot of the motor developmental delays, that's what will trigger us, but then we'll ask a lot of these questions as to why that may be the case. So really it's more of a clinical diagnosis, and we want to make sure we're ruling out other things.
Okay.
But then we will get other things to kind of solidify or confirm that it could be CP, or there was some sort of injury that could have happened. So we might get things like ultrasounds of the brain. We might get an MRI of the brain. We might get genetic testing, which is really improving and getting better and better these days, which is really nice. And we're finding some genetic mutations that can be more related to cerebral palsy.
Okay.
And so we know some things that are risk factors for it. So if we don't know for sure, that we want to officially diagnose it, because sometimes kids are just a little delayed, or sometimes, there's a range of diagnosis or a range of times when they can make these motor developmental milestones. And so we don't want to call it necessarily when it's not it, but we also want to call it when we think it is, and we want to call it sooner, because the sooner we can really say what it is, the sooner we can get the services that are really beneficial. So
Early
sometimes we may not even,
intervention.
what?
I said early intervention.
Exactly,
All things. Yeah.
So even if
Hold
we
on,
don't
say this
necessarily
like
call
that.
it CP right away, we might say like at risk for cerebral palsy, and then kind of go from there. And then again, very monitor closely. Typically it's diagnosed within like years 1 to 3.
Okay.
In more subtle cases, it might take a little bit longer, because maybe they've met milestones a little faster initially, and then you kind of catch on a little bit later. So, but typically between the ages of 1 to 3.
Okay. So when I hear you say ages 1 to 3, I want to make sure I understand correctly. So I heard you say like, oh, they could, bump their head or whatever in those first couple years. If I'm 12 or 15 and bump my head, they're not going to develop it.
No,
Okay. That's a
no.
different
So,
situation.
I can explain a little bit more. So we talk about some of these risk factors, right? Like prematurity is one of the top risk factors, but it's interesting because not every person who's premature develops cerebral palsy, but there are a lot of kids with cerebral palsy that are premature. So they don't necessarily have to happen, but it is very common. A lot of these kids, other risk factors, whether it's in utero, is like a brain bleed, right? Sometimes we have kids that have cardiac conditions that end up having a stroke or something like that.
Yeah.
And they were typical deborn then, and then they had the stroke, right?
Okay.
Versus a brain bleed that happened initially at birth.
Wow,
Or
yeah.
a kid, like kind of like what you said, that was born and was typical initially, and then had some sort of injury, fell, maybe hit his head, had a bleed, something like that, and then started having these delays.
Okay.
So that to help with that, we kind of say like CP secondary to this brain injury, or the CP secondary to the brain bleed. So you kind of have a source, versus when these injuries are happening a little bit later, we really just, for instance, what you just said, we would call it just a traumatic brain injury.
Yeah. Okay. Right.
So,
Okay.
and the reason why that is because the brain development, especially within those first couple years, is huge, right? So when injuries happen, when that brain development is a little bit more further along, how we see the present is a little bit more different. In fact, in general, brain injuries that are more like traumatic, that occur between like 4 to 17 or so, typically have really good outcomes in children. But when they happen a little bit sooner, it's really hard to predict how that brain that hasn't really developed is going to develop now that it's even had more kind of stuff to fight while it's trying to develop.
Okay. Wow. That makes so much sense. Which also, when you're talking about diagnosing and like, okay, we're watching for the delays, and obviously that's a spectrum of the range of when you should be appropriate, gross motor and all that. But it's just such a reminder, like stay up to date on your pediatrician visits, because that's important, I would think, to be able to see like, are we reaching those milestones, and to watch for those signs. So, okay. How about, does CP affect everyone in the same way? I think I know the answer, but tell us more.
Absolutely not. I wish, because it'd be much easier.
Right.
But no, not at all, because there's so many different things that can kind of are risk factors for CP, and then depending on where in the location wise, where it affected the brain, how severe it was, even what the effect was in the brain, it can really impact, and people present very differently. There are some kids or adults with like milder forms per se that you wouldn't necessarily even know that they had CP, or they might just have a slightly funky gait or something like a pattern of walking, right?
Yeah.
Versus you might have some individuals who are much more involved, and they might need wheelchairs, and they might need a G tube or a vent for breathing. So it's this huge spectrum,
Yeah.
and from a functional status, and then even from other comorbidities or other conditions that they might have, that can also vary. Some of them have visual impairments, but others don't. Some have hearing difficulties, others don't. Some have learning and cognition difficulties, others don't. Speech. So unfortunately, I wish that it was easier to treat because everybody was more similar, but because it's such an umbrella term and it's a very kind of dynamic process, it's important that we are being followed, or these children and adults are being followed, because kind of we know what they're at risk for and what we can kind of look for.
Okay. Wow. Yeah, it really is an umbrella.
Yeah.
I had no idea. Okay. So in light of that, I say some could be vision, some could be speech, some could be motor. What are signs and symptoms to kind of look for of CP?
Of CP, the
Yeah.
biggest one would be just in the beginning, not meeting their motor milestones,
Okay.
right? And again, there's a range within that, and even that range actually adjusted a little bit in like 2021 based on the American Academy of Pediatrics and CDC. They kind of adjusted it a little bit, but in general, there's ranges for kids to be meeting these developmental milestones. So when they start becoming very behind on them, that should trigger that they should get evaluated for. The other things that you want to look for is if you know they have certain risk factors, if you know that they were premature and they had a brain bleed and they were in the hospital or in the NICU for a long period of time, if they know that they had an incident before they were 2 where they, were in the pool and almost drowned or something like that, right? That's
Right.
very
Yeah.
indicative that they might had some sort of injury that happened to their brain that was early. So when you have those risk factors, and then you're showing that you're not necessarily developing the way we would expect the children to do it, those should be kind of red flags for the diagnosis.
Okay. I have a question. I'm a mom of 4, almost 5, couple more months.
Congratulations.
Thank you. With that said, we're falling all the time. We bump our heads a lot. So at what point, I had my 6-year-old fell and bumped her head on the concrete yesterday. So, at what point with the little ones, do you be concerned with like, okay, they fell, they bumped their head, I'm going to watch them.
Yeah.
And then this could be something serious,
No, that's a great question, and people ask it all the time, right?
Yeah.
Kids are going to be kids. They're going to fall. They're going to play. They're going to get injured all the time. But if you notice that personality changed, they're not
Okay.
moving the same way. They're not eating the same way. They're not sleeping. They're more cranky. Or the younger ones, they're more fussy, or they're not necessarily, whatever their feeding
Themselves.
is. Yeah.
Yeah.
Then you might want to get that checked. Just because
Yeah.
they fall, if they fall and they have a huge lump and something like that, maybe go get them seen, right?
Yeah.
If they have other signs that could be injurious, that like there was more fractures and stuff like that, where they have fluid coming out of their nose, or like there's some bruising around like the eyes, those are more concerning signs, period. And I'm pretty sure
Right.
most parents would see that and go directly
I
to.
know.
But it's the more subtle ones where they fall and then they're kind of act like themselves, and everybody's like, should there be something I should worry about? And it's hard to say, right? I can't necessarily tell you when and to for sure go. There's no like one and done sign that you should, but you monitor for changes. If they're not moving, if they're moving one side of the body and not as the other side as much, things that you would notice that would be changes.
That's good. That's good. I think
And a
just
lot of those kids also, what?
just as a parent, it's like
Yeah.
the kids are going to fall. They're going to, the little ones even,
Yeah.
And so, yeah, it just can make you nervous. So that's good.
Yeah. And it's tough at that age too, because a lot of those kids can't explain a headache.
That's right.
But if a lot of them will end up start complaining about like belly aches and stomach pain, like that's how they just don't feel well, and they like point to their stomach often. And that's just, maybe a sign that you do want to at least get it checked, or at least monitor closely and stuff like that.
Yeah, that's great. That's super helpful. Okay. I think I'm learning. So I'm in my mind, I'm projecting answers because I'm learning so much already, but, can cerebral palsy be passed down or inherited?
No, it's not an inheritable disease or condition, I should say.
Yeah.
When I say that there can be genetic causes, is now with a lot of improvements and advancements in genetics, we are seeing that there's certain mutations that can happen that might be related to these global developmental delays that then we call
Mhm.
cerebral palsy.
Okay.
So, and then those aren't necessarily inherited.
Okay.
Now, with time, this might actually change. The more we get to know about genetics, maybe we'll
Yeah.
find different answers. But right now, it's not something that's passed down per se. And
Yeah.
remember, when you're talking about a human, we have like 20,000 genes,
Amazing.
right? And so they can kind of have a little mishap at any point.
Yeah.
So when there are delays, sometimes like if kids don't have these obvious risk factors where they had this brain bleed or they were premature or whatever the case may be that are more obvious, then we'll often send them for genetic testing because we want to know why this is happening, right?
Yeah.
Um, and then maybe we can get some answers.
Yeah, it's so fascinating. I think with all your background and just the research, there's a wealth of information. It's amazing. Okay, along those lines, similarly, we have a question from our audience. And this person asked, are there any stem cell therapies that work with kids with CP? It says, this audience member said there's some studies carried on by Duke, and I'd love to know the doctor's opinion.
I honestly don't know as much because they're much newer in the States. I believe,
Yeah.
I want to say Mexico, but I might be making that up, has some going on, or
Okay.
they're doing some in Mexico too. It's too early to say anything personally.
Yeah.
Plus I haven't looked at it relatively recently, so I necessarily don't want to give you information that I don't know.
Yeah, I appreciate it.
But I, stem cells is an interesting topic in general for in many conditions.
Mm-hmm.
So I would be interested to see what comes out of it. But it's definitely not something I know enough about and feel comfortable to kind of speak of.
I appreciate that, but thank you. All right, audience, great. Keep your questions coming. We love having questions. Here's one I'm just going to kind of sprinkle in. If someone, say an audience member, wanted to set an appointment with you or meet with you, what's the best way to do that?
Sure.
Go
You
ahead and
can
get that out of the
usually,
way.
it's a
Taking
great
notes,
question.
everybody.
I'm happy to give numbers. So if you want to make an appointment, most of my clinics are at the Lynn Rehab Center.
Awesome.
And so the number for that, I always sometimes forget, so I'm looking it up. Not
No,
gonna,
perfect. We'll
is
put it in the chat too.
305-585-9420. But if you had questions for anything else too, my personal admin, I can give you her number as well, which might be a little bit helpful too, is
Oh, okay.
305-243-3140.
Awesome. We will get that shared in the chats as well. So you guys have that so you can make a note. Awesome. Thank you for that. Sometimes, we like to
Yeah,
contact
happy to
the
help
doctor.
whenever I can.
Yeah, I know. I always wish, I'm like, man, we wish we had time for like everybody's, situation, but make an appointment and you'll get some great care there. Thank you. I saw that Constanza put the number there. So thanks. Okay. So what signs you talked about the delays, looking for delays, and obviously there's just the spectrum and a range of the delays, but what signs could indicate that our child may not be developing normally? I know you said to watch for those things early, but maybe just talk us through some specifics of that. Maybe there's a mom listening who's has a little baby and is like, I'm watching for signs.
Yeah. So in general, well, to start, I guess I would say there is a widely used tool that's through oh my goodness, AAP, the American Academy of Pediatrics also
Mhm.
uses it, healthychildren.org. It's like a motor delay tool
Okay.
that you
Awesome.
can use to help track the child's development. So you can have a little bit more idea if they're delayed, right? If they might not meeting things on times. The other things that you can look for is if their heads are like, after a couple of months, if the head is still lagging when you try to pick them up,
Okay.
they feel very, very stiff when they try to move. And so like sometimes their legs even cross each other.
Okay.
When you cradle them or something, if they kind of hyperextend their neck and their back all the time, they're constantly acting like they're trying to push away from you.
Okay.
Um, when I'm trying to think of like other very trigger ones, if they don't always roll, but if they'll roll in one direction but not roll in the other direction, maybe they are using one hand but not the other.
Mm-hmm.
Similarly to crawling, if they're kind of or scooting on their butt, but you see them kind of extending with one leg only all the time, maybe
Okay.
one side is affected,
Okay.
and the other one might not be. Um, uh, Maybe if they're standing up the same way, right? They always just put the one side the one foot down to kind of stand up. So they're clearly using one side, one arm more than the other side. They can have more of the hemiplegic picture, the one-sided picture.
Okay.
Um, those are some good indicators, and at least pretty early on that would give you an idea.
Yeah, super helpful, super helpful. What about, okay, I think I know the answer to this one, but you're the expert. Is cerebral palsy contagious?
It is not
I'm
contagious.
going to say
It
no.
is not a
Brain
disease,
injury.
quote unquote. Yeah, yeah. It is
Yeah.
not
So
contagious at
this is a
all.
great question that we received from the audience too. Okay, so it's obviously a condition of the brain. So what exactly is happening to the brain? Like, our brain cells or neurons like not functioning? Are they dying? Like, what's going on actually in the brain?
So you just had an injury to the brain, some sort of, whether it was a lesion or it didn't form the same way, or you had a bleed that then affected the tissue, or you had a stroke that also affected the tissue and didn't allow the vasculature there. That then, because the brain is so immature in its development, it hasn't formed all those connections necessarily that are happening,
Okay.
that are then going through the entire body. And so those signals are just abnormal.
Yeah.
And again, it's really hard to predict the way then kids are going to present. And that's why also kids just present so differently.
Right.
But then how that then affects your body is because those signals are abnormal going down. So a lot of these kids will have these either really, really tight muscles, or they'll have these like abnormal movements that they can't control,
Okay.
depending on where the injury kind of occurred. And the reason for that is they have this abnormal signal that's going down that your body then can't kind of give it the appropriate feedback to stop it.
Gotcha. That
So
makes
there's
sense.
just kind of inappropriate signals, or that you can't necessarily control, because the brain was forced to develop differently than it wanted to, I guess.
Right.
If that
Right.
makes
Right.
sense.
Yeah. Yeah. That makes perfect sense. You explained that great. Wow. So good. So on that line, is it progressive? Like, does it get worse? Is it life-threatening? Like, talk to us about that.
Great question. So the injury to the brain itself is not progressive. It should be one time a static
Okay.
injury. That
Okay.
being said, how it does present might change over time, in the
Okay.
sense that as the brain is growing and developing, it is then causing other to the injury already happened, but that brain still has to develop on its own. So then how it presents could also change. And then just how the body is moving and how the body's functioning then changes over time. So
Yeah.
you might have more wear and tear of bodies. You might have muscles being really tight, and then you have some weakness in other sides. So then you have bones being turned in different directions, which then makes that worse over time, especially when kids are then going through growth spurts that are then the muscles are trying to go, or the bones are trying to go, but the muscles won't go with them. So things are turning. So when they are clinically manifesting it, when they're presenting, that itself might kind of a change over time.
Right.
But the injury itself is a one-time
Permanent. Yeah.
occurrence.
Okay. All right. When we talk about the brain, I mean, I immediately think cognitive, like our brain is doing all the cognitive stuff, but also our brain is doing everything physical and all emotional, all the things. So is it fair to say, okay, well, a child with CP experiences developmental delays, but does that also indicate a level of cognitive delay or ability
So it's a
necessarily?
great question, and not necessarily. I
Yeah.
will be the first to always tell my patients, when you walk in and you see a child or an adult that has physical impairments, do not just assume
Yeah.
that they don't understand what you're saying, they can't communicate
Yeah.
with you.
Yeah. Yeah. Yeah.
It's very, very important to realize that one doesn't necessarily mean the other, right? There are different areas of the brain that are in charge of different things and different functional abilities. Now, about 50% or so will have learning and cognitive
Okay.
disabilities, but definitely not all of them.
Yeah.
Some of them can be very, very physically impaired, but
Yeah.
also cognitively super smart, right? You just
Yeah.
have to give them the right devices maybe to be able to communicate. Maybe they can't talk, and maybe you wouldn't necessarily know, and then you give them this eye gaze device, and then they can kind of tell you everything, which is just
Amazing.
incredible.
That's
Yeah.
incredible.
So it's really important to take that into consideration, that one does not necessarily mean the other.
Yeah. Wow. I've got to think I would love to be a fly on the wall or a visitor one day in just your rehab center, because I can't imagine all of just the creative means and ways. And like you said, this umbrella, situation where it affects people so differently. So there's so many specific treatments. Along those lines, we're getting a few audience questions, and I'm seeing what you're saying of like different situations are very specific.
Yeah.
So here's a couple. One is my sister is 18 and has had CP since she was a preemie. Do you have any advice for teens with CP? I can't imagine of like being a teen at all. It's so hard and
I
challenging.
know. My
But
biggest advice in
yep.
general, especially as they're getting to that age or even little in their teens, is to try to understand your own body and learn how to advocate for yourself.
It's
Right.
great.
I don't know how she presents or how involved she is and what her abilities are. But if they're able to, as they're getting older, it's really important for individuals to be able to know what they need, understand their body, and know how to ask for it.
Yeah.
Right. Not at all against adult providers, but the pediatric way of doing things can be slightly different than the adults.
Yeah.
Oftentimes we do more sometimes multidisciplinary clinics where you'll have multiple providers in one room and see them all at the same time.
Right.
And you don't have that necessarily in the adult world. And then that becomes overwhelming for patients that then have to transition. Bless you.
Excuse me. Trying to mute it in time. I don't know if I
You
got it.
did. It becomes overwhelming for patients that then have to transition to the adult world and then have different appointments for their primary, but then neurology and neurosurgery and orthopedics and rehab and cardiology. And, it is a lot at once. And then
Yeah.
people then fall off and decide not to go see this one or not to go see that one or stop taking this medication.
Mhm.
So my biggest advice, unless there's something more specific of that question, I apologize if I didn't answer, is
Oh, great.
to be able to understand you and know what you need and advocate for yourself.
That's awesome. That's awesome. Taking that ownership as an advocate wherever you are on your health journey, I think is huge. And especially as parents for our children. Okay, here's another one.
Mhm.
So another audience member says, is there a link between CP and epilepsy? This person's daughter had convulsions when she was born, but then she was released from medication soon because the studies were normal, but then the convulsions came back when she was 3. So is there links shown?
So if you want to say links, basically any injury to the brain can also cause the development of epilepsy and seizures.
Yeah.
And those seizures itself and the continued injuries to the brain, which then can cause CP,
CP.
if that
That's
makes sense. So
yeah.
it's kind of, yeah. A lot of kids sometimes when they're really young and they have this febrile seizure once, not necessarily, but if they
Yeah.
have these repeated seizures that are happening,
Yeah.
whatever the reason is behind it, it could result in those functional functional disabilities and that delayed development that then we would identify as cerebral palsy if it happened early enough.
Yeah. Wow. That's helpful. All right, here's another one. Is there any organization that you know of that can help children with CP who only have toe walking as a sign and whose walking is not so severe? Since most doctors have not taken my daughter's case very seriously. Oh, I hate that. Since she only has this one condition, she's a child with completely normal development otherwise.
Um, she's
No, that's
diagnosed.
hard because that's a
Yeah,
very
that is
specific. Yeah.
and the daughter's diagnosed with cerebral palsy if this person.
Let's see. Comment below again in the questions so we know. But she says help children with CP who have only toe walking as a sign. Whose
So, I
walking
mean,
is not severe.
only toe walking is still a sign of, so it could be a sign of cerebral palsy. So it depends on what other conditions I might have, what's causing the toe walking, what the muscle tightness is,
Yeah.
um, what the range of those muscles are.
Mm-hmm.
I don't know what she wants by a particular organization to help. I'm happy to see them and try to decide, but intervention wise, there's different ways to try to help the toe walking depending on kind of how they're presenting again, which it's difficult to say based on this.
Right.
And then what the functional goals are, right? So to go, kind of go on top of that, I guess, to add to that, abnormal tone or tightness in muscles is really, really, really common in a lot of these patients.
Uh-huh.
So toe walking is very common.
Okay.
Most of the things that we try to do for these patients, and we usually try to start more conservatively and then kind of go more drastically from there, is a lot of therapies, we'll encourage stretching, break, and that stuff at home, period. Sometimes we'll give nighttime bracing to kind of help that stretch when the kids are asleep, so they don't have to necessarily be bothered and reminded to do it all the time and think
That's
about
right.
it. Sometimes we'll give braces to wear during the day while they're walking to try to help them put those heels down when they're walking.
I love it.
If they need to, if for somebody like that, we're we're probably not going to give them like oral medications because it's so localized to their ankles. I'm assuming in this case.
Yeah.
But there are medications we can give if somebody has more tightness or abnormal muscle tone in more generalized areas.
Uh-huh.
There's injections you can do to the muscles that kind of release and kind of hopefully relax those muscles a little bit.
Mhm.
And in those cases, we'll do like the injections, and we still ask the parents to then still do the stretching, right? If you kind of
Yeah.
inject a muscle, then you leave them kind of bent, it's not really useful. So you want to, if you're going to do the injections, and that stretching
Yeah.
is going to be even more important. Sometimes we'll even like do the injections and then ask for serial casting while they'll cast them, not, it's kind of like a fracture, but they're able to bear weight in everything anyway.
Okay.
You'll slowly basically come in like every week, and with that cast, just slowly
Stretching it out.
stretch it.
Whoa. Wow.
And then if needed, there's surgical interventions. You know, ultimately, depending on age, we try to avoid surgical interventions too early, because ultimately sometimes these kids need repetitive surgeries.
Yeah.
So the goal, especially for me as a rehab provider, is trying to prevent the need for surgeries at an early age and prevent the complications and all that. So I don't know if that totally answers that question about toe walking.
I think it answered like 10 more, which is great. I'm excited. I want to kind of ride this wave a little bit in terms of just specific treatments and stuff that you guys are using. Cause I imagine that there is just a plethora of so many different creative ways and things, because like you said, different situations need different degrees of intervention and that kind of thing. One question that we got from the audience is, can you share like treatments to help with motor rehab? Obviously that's very broad, because like which or how much, all, but this person said they saw pictures with kids doing some assessment. And I think this one must live abroad, because they said for people who live abroad, are there possibilities to go for a complete check? Like, can someone come here and see at the rehab center and get a full assessment or evaluation of what exactly they need? How does that work?
To come internationally is possible. We actually have had kids before. I'd have to work with our international department, which is not a problem. I just need to know.
Yeah.
If you want for those individuals who want something like that, feel free to reach out to that number, the 3140 that I put there. And you can write that that's what you're interested in, and that you saw me on here or something. And then give me some information regarding, I guess whoever you want me to see, your child, whoever it is, and a contact number. So maybe we can kind of communicate and start that. Because there's definitely ways to get her to get evaluated.
Yeah, that's awesome. That's awesome. I think that's like, to our audience, where else in the world can you come and like learn from an expert? And they're like, call me, like, share with me what you need. That's a great tip. So yeah, assuming you guys do a full assessment of all the things, that's great. I know it's hard to speak to like specific
Yeah,
things.
well, you would probably start with me specifically, but then if knowing this, I would try to coordinate, because this is what we've done before. We try to coordinate with, I would ask you some details so I can know a little bit more of what else you need. And
Yeah.
then try to coordinate with some of the therapists so I can have a physical, occupational, and speech therapy available for an assessment around that time too. And then, to be honest, if there's other concerns that maybe require other providers, I would reach out to the other specialties as well, whether it's neurology, pulmonology, whoever might be required in your case. So it's not necessarily the easiest thing, but we've definitely done it, and I'm happy to try to do it. So there are ways.
Yeah.
We might contact you for more information.
That's great. Awesome. Thank you for that. Okay. Question: is cerebral palsy permanent?
It is a lifelong condition. Yes. The injury that happened early, and then because of it, you're then having this lifelong condition. Now, again, how you present can change over time, and what you're able to do is not necessarily just indicative of just saying cerebral palsy, right? But it is a condition that you do have forever.
Yeah. On that note, an audience member asked, what about like cerebral plasticity? I'm thinking like the neuroplasticity. Like, is it true, take advantage of the years between 0 to 6 where the brain is
Yeah.
really morphing and growing? But are there any other windows during the teenage years they want to know?
So there's always some aspects of neuroplasticity, even in our adult world, when they have a brain injury, early intervention is going to be very important in general after an injury because of the neuroplasticity. It's just extra amazing when they're very little, right? Because
Yeah.
that brain just hasn't even developed yet, so it's working on its way of doing that. So that's why early intervention, particularly in these children, is so, so, so important.
Yeah.
But you do have those in particular in CP, I don't know if you have this like whole new time frame that it just becomes great again. But I will say that during puberty and during when that kind of growth spurt's going to happen, not that they have this new ability to get better, but actually they have this risk of things getting not worse, but kind of at risk because they're growing really fast. And if
Yeah.
they don't have muscular ability in their trunk, that trunk might actually curve more, causing more scoliosis, right?
Mhm.
As their bones are trying to grow based on what they are like genetically coded to kind of grow, but you have muscles that are kind of pulling them in different directions. Those bones might kind of curve or like end up growing in different ways and kind of turning and stuff like that, causing problems. So on the contrary to your question, I guess is not what you were hoping to hear, but that's a time frame, a time that it's really important that you're doing the stretches, you're seeing your doctors, you're getting your x-rays or whatever you need to do to really monitor for those things that might occur.
Yeah, that's awesome. That's great advice. Okay, we talked about how it is a lifelong condition. So if it's a lifelong condition, like, is there a cure necessarily? Would we say there's a cure? Kind of
Yeah,
always.
unfortunately, there's no cure, as in there's no like cure for the brain injury itself.
Great.
But there's treatment and management options that we have that we use for the symptoms and their clinical manifestations, right?
Yeah.
So for the tone, for instance, that we kind of just mentioned, right? There's anything from stretching to surgeries with
Yeah.
things obviously in between.
Yeah.
They might present with pain, right? A lot of actually pain is a huge uh, really undertreated and underdiagnosed, underrecognized condition in a lot of children and adults with cerebral palsy. A lot of adults with cerebral palsy have chronic pain that really starts in childhood, but we don't necessarily treat it, especially in those that have communication difficulties, because we don't always know what it is, right? And if parents don't think they're in pain, so we don't necessarily do it, but
Oh.
maybe they are, or maybe they are in pain and we think it's because the tightness in the muscles or because the hip is out of place.
Mhm.
But in actuality, they like had a UTI and we just missed it, right? So there's what we do is we're treating their symptoms and how they're presenting to try to um, maximize, from my standpoint, the functional abilities and to make sure they're not having all these other symptoms that can be burdensome or problematic.
Yeah, that's good. Now, I know this would be specific again to each situation, but you talked about treatment options. I heard you say surgery. I heard you say stretching. There's a number of things of even I heard you say OT and speech therapists and all these other therapists that you get involved. And so I'm sure they all have their little things. But what are some things that parents can do at home? Again, I think this also in my mind, I'm thinking this is why the pediatric rehab center is so important because you need to go to get all these resources because they'll be specific to your situation. But kind of what are the things you would say that you're seeing parents do at home that's like really making an effect?
So I would say definitely stretching is going to be one of the top priorities at all times. That's why sometimes we'll give you again braces and stuff like that that help you stretch, so you on your own don't have to do it all the time because it can take a lot, right? Or kids don't like it and they're not happy with you.
Yeah.
So stretching is always going to be important because, like I said, that tone bringing your joints in a different direction, right? The therapist in general, PT, who does more gross motor stuff, OT that does more upper limb stuff, and even speech, they'll give you exercises and stuff that you should be following up with at home, which are going to be really important.
Great.
And then I would say it's also if you can do like weight bearing. So sometimes kids that don't necessarily walk or stand on their own will give you a stander, just because being able to stand and be upright is really good for stretching those muscles. It's really good for stretching those joints. And it's also really good for your bone health, right? Because if you're not bearing weight, then you're not kind of causing that bone to build the way those of us like people who are walking all the time, right? When you're kind of putting that
Right.
pressure on their bone is breaking down and kind of building up and you're making it stronger. So you're
Yeah.
not putting weight on it, you're not allowing that bone to build. So those bones are also weak. And so they can be at risk for more fractures and stuff like that. So those are also simple things that can be done at home. Um, if they are walking or they are trying to walk, they might need just like a gait trainer. And so that's going to be something kind of like a walker, but it helps hold them up at the same time. And that
Mhm.
allows them to do the same thing as the stander does and stand, but also do the act of walking, which can be very good.
Yeah.
So there's a lot of things that parents can do at home on their own. but a lot of it we hopefully help you do, right? So a lot of it you're going to need us to,
Guide you.
provide some of these equipment for you that could be useful for you.
Yes.
So when you're talking when you're talking about treatment of individuals with cerebral palsy and many other conditions, you have a whole team, you have of people that are involved, but ultimately the parent and the patient, or the caregivers, right? The families and the patient are the captains and the coaches of the team, right? You guys are the most important part.
That's right. That's right. Make the appointment if you haven't already. No, and then just keep keep advocating, like you're saying. Even just I love the guest who's on here who's an adult with CP. He's like, yes, I had to advocate for myself, you know, all grown up. So that's awesome.
And I'll say
Okay,
with just to add just to that,
please.
because that person with cerebral palsy, an adult, it can be very hard because there's adult providers are not
Yeah.
always comfortable treating uh adults with childhood conditions.
Okay. That was going to
Um,
be one of my questions is like, do adult physicians manage CP and like what happens when you need to transition from like a
yeah.
pediatric provider to an adult provider?
So it can be difficult. There are a lot of places that are trying to develop transitional programs. Um,
Awesome.
when you think about it, really, cerebral palsy is a brain injury, and at least in rehab, we have brain injury providers, so they
Yep.
should be able to. And they typically do. People just in general don't necessarily feel as comfortable with it as I think pediatric providers. Um, but I think that's also why it's really important for patients to understand what they need and how they can advocate for themselves.
Yeah.
Now, again, physicians do and can, and they know what to look for, but just some aren't in general, some of them aren't as comfortable.
Yeah. That's great. Thank you for sharing that. Okay, back to the stretching again.
Okay.
So stretching is good all the ages, all the way through, right? Keep the stretching going. Don't stop the stretching.
Correct.
Great. We got a question was like, okay, is it good for this age? And then I'm like, all the ages, stretch.
Always, always
Don't stop
stretch,
stretching.
always stretch. Because anybody who's in a position for too long at
Yeah.
any point can
Oh
get
yeah.
stuck in that position.
Yeah.
So these kids end up not only having some weakness in some muscles, but oftentimes the opposing muscles are the ones that are really strong and kind of override. So then
Yeah.
not only are they not moving themselves, then they have these muscles that are pulling them in different directions. And then they can have that ability of getting stuck at any age.
Mm-hmm. Mm-hmm. Okay, thanks for that. A few more questions. I'm watching our time so we
Okay.
can get everybody who is on their lunch break and get you back to the rehab center.
Thanks for offering.
Um, okay, let's talk about, uh, maybe someone's just getting the diagnosis or, they're new into it and they're like, what in the world does the future hold for my child? Like, it just can feel any diagnosis can feel just
Yeah.
overwhelming. Like, can my child go to school? Can my child go to work? What kind of challenges is a child with CP going to face? Talk to us.
That is a great question. And typically the diagnosis can be extremely overwhelming, especially since, again, you get the diagnosis, you look on the internet and you literally see like the worst of the worst,
Yeah.
which is not at all every case, right? And so I wish there was a way for us to predict exactly how each person or each child is going to ultimately look, in 6 months, 2 years, 12 years from now. It's not possible. So that's a very difficult question to answer. We typically try to tell parents and families that the diagnosis itself doesn't define their future, right? It really enables us as your team and you to hone in on specific interventions that really might improve their development and their independence and all of that. So we want to take the diagnosis itself kind of helps guide the treatment plans, right? It tries to guides our decisions that we're making. It guides what other things we're looking for and we're monitoring for because we know that what they're at risk for.
Yeah.
And in our minds also, it helps accelerate the services that they might need. So we want them to get this early intervention. So giving that diagnosis can be really crucial for that.
Right.
Just to go on top, because I know that people want to know answers, but one of the biggest things people ask all the time is, will my kid walk?
Yeah.
And like I said, there's again, no way to specifically tell you yes or no, but we do have prognostic indicators that will tell parents.
That's great.
Typically if a child can sit independently by 2 years of age, it's typically a good indicator.
That's awesome.
If they can crawl by 2.5 years of age, another good indicator typically.
Great.
But if they have some of those primitive reflexes or those reflexes that exist at birth that are supposed to kind of disappear per se, but they're kind of overridden, around 1 year, they're supposed to all be gone. If at least 3 of them or more persist at 2 years or 24 months, that's usually a bad indicator.
Yeah.
So sometimes we'll use that to just give you an idea, but it really is impossible to make any predictions, right? I know that I've had patients that come to me and said, like, this doctor said I was going to be able to do this, this, and this, and then the opposite happens, or vice versa, where a doctor says I'll never be able to do this, and they looked phenomenal, right? So it's really difficult. So it's important to just finding that healthy state of mind between being open to positive change but being realistic at the same time.
That's awesome. Wow. That's what do you call them? Prognostic indicators?
Yeah.
Learning all my medical terms today.
Sorry.
No, it's great. You're teaching us so much. But okay, I love that you're talking about for like the motor development walking. Are there prognostic indicators for speech as you're describing for walking? Are there things like that as well?
Not as much, at least not that I know of.
Okay.
But one of the things that is found, research has shown that hearing loss then obviously affects speech. So if
Right.
you don't recognize that there's hearing loss early enough,
Yeah.
then that could
That's
ultimately affect their
huge.
speech. So that
That's
also is important. Now, most kids end up having their hearing checked, right? Their
yeah,
newborn hearing screen.
right.
So we typically should be finding it anyway. But the research does show that if they have hearing loss and it's not found early enough, and that then can affect their future communication skills.
Yeah. That's great. Wow. There's so much here. I'm just like thinking from 54 minutes ago, I have like completely changed my whole scope of reality of understanding CP, and which is why we do these webinars. We want to support, we want to encourage families, childcare providers, just people who are working with children and teach and equip. And I just think, wow, there's just so much we don't know and understand. And even especially in the community of like, let's advocate for inclusivity with our children. Let's teach our children these things. I'm like, man, like I need to know these things so that I can help my kids understand as they engage with those who God designed different. And that's
Yeah.
okay.
That actually, I'll just second that. Like, I
Please,
think
please.
that understanding the adaptive recreation, adaptive sports, and those things that are out there too, get the kids involved, right? It's really important that they feel like they're the same as their peers, When kids are really young, they look at their maybe walkers or wheelchairs or the other assistive devices that may use as an extension of themselves. They don't look at it as a negative.
That's
We
right.
as a society, as they get older, then kind of place it on them.
That's
So it's
right.
important that they learn how to use all these things and they understand and they see what's out there and they can be surrounded by all their peers and have a good time and participate and they want to do those things.
That's awesome. Oh, I love that. Yes, advocating for that. Ah, Dr. Gober, you're amazing. This was outstanding. Such a great Q&A. I know our audience enjoyed it. We tried to get every single question. I think we covered everything we could. Let me make sure I didn't miss anything. I tried. Oh, here's one that I wanted to ask.
Sure.
What advice would you give? And we'll close with this. What advice would you give parents on managing their expectations for their child? Because I've got to imagine like there's a social emotional component to all of this, so how would you encourage them and just encouraging their child with
Kind of
CP?
what I said. I would say stay open-minded, stay optimistic, but also realistic, right? So if you come in and your child never walked and then we were being presented with an opportunity to do surgeries because they're in a lot of pain, the idea that they might walk and run a marathon after that might be unrealistic, right?
Yeah.
But on the other hand, there are kids, I think I read that this person didn't speak until 5, right? Like just because they're not necessarily doing it on time doesn't mean they're never going to do it, right? I've had a kid that started walking, I think at like age 8, which realistically you wouldn't necessarily think that would happen, but anything is kind of possible, and there's really just no way to predict it. But I would tell families also and caregivers just also to take care of yourself, right? Like the quote that says, and I'm sorry if I butcher it, but
No.
you can't pour from an empty glass, right? So if there's nothing left in you, you're not going to be able to take care of your child. So find that kind of healthy balance between ask for help if you need to. I think they'll show some resources that we can like that are available that they can maybe help because it's going to be important. It can take a toll on the relationship of families altogether with both parents, husband and wife, or uh, whoever the caregivers are, other children, right? If mom and dad or mom is always with um, the kid with cerebral palsy because he has to go to this school and this therapy appointment and this thing, and then they miss the soccer game of their other child, right? That other child can get upset. So it is a big burden, a lot of conditions. You know, obviously this is a spectrum, so not always the case, but take that all into account because it's going to be important for you to take care of yourself, your whole family, to really make everything as great as possible for everybody.
Awesome. Dr. Gober, thank you. And I think I'll end with this. I also want to tell you about our next webinar coming up, but if you've got specific questions, because I know we all have specific situations, but you know, occurring to like your own diagnosis or your child's, or you're looking for a contact for orthopedic or this or that, start with that Christine Elin Rehab Center, these numbers that we put here. I'm going to ask us, see maybe if Patty can put them there again, so they're at the bottom of the chat so you can see them. But and then also Dr. Gober's office, you know, she's an incredible resource and continually available to you. So I would just say for that, and I hope that you all have enjoyed our episode today. It was incredibly informative. Thank you so much, Dr. Gober. I want to tell you to please, please, please mark your calendars to join us for our next one. So we do these once a month. The next one is going to be Thursday, April 18th. And right here on your screen, you could screenshot this if you want, but if you want to continue your research on cerebral palsy, there's great resources here. So you can just screenshot that or take a picture with your camera. But next month, April 18th, stay tuned for the time. You all voted, so stay tuned for the time. But the next parental guidance episode is going to be in Espanol. So I will not be here because you don't want to hear my Spanish, but an excellent Spanish speaker will be here with our expert, and we're going to talk about excessive screen time and social media. Wow, this is such a hot topic. I feel like we need an adult edition of this because this is something that affects all of us. But excessive screen time is associated with a number of health issues, and it really can have a negative impact on your child's sleep, on their development, on their social emotional, all of that. So once your child is old enough to have their own phone and gain access to social media, they have access to a world of increased risk of depression, anxiety, loneliness, inadequacy. Like this is a huge, I would say, epidemic facing our world. So learn, when is it developmentally appropriate and acceptable to introduce screens to your child? How can you limit your child's exposure to digital devices? And how can you navigate your child's life on and exposure to social media? This is not going away. So it's something that we as parents, as providers and childcare providers, we got to stay on top of. So join us. It's going to be Thursday, April 18th. Mark your calendar. You'll get an email with the time and all that good stuff to register, but just go ahead and save the date. And then again, recordings of all of these webinars and episodes are available along with downloadable resources and tips at parentalguidance.org. So you can sign up for future webinars there. This one, if you watched it, you want to send it to, you know, a spouse or a friend or someone you know, it's going to be available there soon, so you can forward it right on, send the link, but just give us a week or so to get it up there. But otherwise, thank you so much. Audience, you guys were great participating, asking awesome questions. Dr. Gober, you were fantastic. Thank you for bringing your expertise today. And it was just great to have a conversation with you. We appreciate you.
Thank you so much for having me.
Awesome. Everyone have a great rest of your week, and we'll see you April 18th.